So today we're going to do a bedside assessment, and before I enter the patient's room, I'm going to check for fall precautions or isolation precautions. And as I enter the room, I'm going to perform hand hygiene, and I'm going to check for any safety hazards, and I'm going to introduce myself to the patient. Good morning, my name is Amy. I'll be your student nurse today. And we're going to perform our bedside assessment, but first I just need to take a look at your armband, and if you can tell me your name.
It's Rachel.
And date of birth.
3484.
Okay, great. So as the bedside assessment, the first thing I'd like to do is go ahead and get a current set of vital signs.
Okay.
And once I've done that, I'm just going to ask you about your pain on a scale of 0 to 10, 0 being no pain at all, 10 being the worst pain that you've ever had. Are you having any pain today?
No, I'm at a 0.
Okay. And if she was having any pain, then I would assess using the old carts method. Patient appears to be relaxed, has good eye contact, good hygiene and grooming. Facial expression does not indicate any pain or distress. And so the next thing that we're going to do is the neurologic. And the first thing I'm going to do, first thing I'm going to do is ask you to state your name for me.
It's Rachel.
And do you know the date?
March 30th.
Okay. And do you know where you are?
John Tyler Hospital.
Okay, so the patient is alert and oriented ×3. And now what I'm going to do is check your eyes, if I can just get you to look straight ahead. Okay, and the pupils are equal, round, and reactive to light and accommodation, and 3 millimeters bilaterally. And so the next thing that I'm going to do is ask you, have you had any problems swallowing?
No.
Okay. And what about with sensation?
No.
Okay, let me just, so no numbness or tingling?
No.
Okay, you can feel that okay? And up here as well?
Yes.
Okay, and there's no apparent ptosis or facial drop. The face is symmetrical. And I'm just going to ask you a question to assess your speech and communication. Can you tell me what you had for dinner last night?
Chicken and Brussels sprouts.
Okay. Patient's communication is logical and appropriate. And so now we're going to move on to respiratory. I'm going to assess the patient's rate and effort, and the rate is 16. Breathing is quiet and effortless. And now I will auscultate for breath sounds. If I can get you to sit up so I can do it this time. Okay, and lung fields are clear, breath sounds are clear, and I'm going to check for clubbing and cyanosis. There isn't any. And have you had a cough lately?
No.
Okay, but if she had a cough, I would check for color and amount of sputum. And then I'm going to go ahead and move to cardiovascular. And the first thing that I'm going to do for the cardiovascular assessment is to listen to the apical pulse for 60 seconds. And I'm listening for S1 and S2, which are present. Rate and rhythm are both regular. And then I'm going to listen to the apical pulse at the same time that I assess the radial pulse to make sure there's no pulse deficit. Okay, and they're equal, there is no pulse deficit. And so the next thing I'm going to do is go ahead and assess the sounds at the aortic, pulmonic, Erb's point, the tricuspid, and the mitral. And I would also do that with the bell of the stethoscope. Then I'm going to assess the radial pulse bilaterally, easily palpable, 2+. And then I'm going to check for capillary refill, which is less than 3. I'm going to check for that down here as well, also less than 3. Then I'm going to check for any pretibial edema, and there is none. And then I'm going to check the posterior tibial pulse, which is easily palpable 2+, the dorsalis pedis pulse, which is also easily palpable in 2+. Then I'm going to check for the temperature of the skin which is warm. Then I'll actually move on to the skin assessment, and skin color is pink, appropriate for race. Again, the temperature of the skin is warm. The skin is dry. I'm going to check for turgor. The skin is elastic with no tenting. The skin is intact with no lesions noted. And now I'm going to check the musculoskeletal system. The head, face, eyes, hips, thorax, arms, legs, hands, and feet are all symmetrical with no deformities. Now I'm going to check extremity strength, and I can check your upper extremity strength. And if you can pull against my hands and then push, okay. Strength is a 5, bilaterally symmetric, and full resistance to opposition. And then I will check the feet in the same manner. If you can lift your feet, okay. Also a 5 of strength, bilaterally symmetric, and full resistance to opposition. Have you had any problems with your range of motion? You're able to raise your arms over your head, please, and lift your legs one at a time, okay? No limitations with arms and legs as far as range of motion. So we will move on to the abdominal assessment. And the abdomen appears to be flat, and patient appears to have appropriate nutritional status. So then I'm going to listen to the bowel sounds in all 4 quadrants. Okay. Bowel sounds are present in all 4 quadrants. And have you been tolerating your diet okay?
Yes.
Okay. And are you able to pass gas?
Yes.
And your stool?
Yes.
Okay. And when was the date of your last bowel movement?
This morning.
Okay. And are you voiding regularly?
Yes.
Okay. And I would check for the color, clarity, and quantity of the urine. And then I'm going to assess activity. If the patient is on bed rest, I'm going to turn her every 2 hours. If indicated, I will get her up to the chair and assess how much assistance she needs with that, what assistance she needs with ambulation, if she requires any ambulatory aids such as a walker, a cane, crutches. And then we'll talk about equipment. She's not on any oxygen, but if she was, I would check the appliance and the setting and the placement of that to make sure that the flow rate was appropriate. Then I would check if she had an IV. I would check to make sure that it was the correct fluid, that it was pumping at the correct rate, and I would check the insertion site. If she had a catheter, I would check for that the device was secure, that there were no kinks in the tubing, and that the reservoir was placed appropriately. I would assess any dressings to make sure that they were dry. I would assess any drainage of tubes, and I would assess any SCDs, TED stockings, and foot pumps. And then finally, before I leave, I'm going to make sure that the bed is in the low position, that the appropriate side rails are up, that the patient has the call bell within reach, that if a bed alarm was necessary, that was activated, and then I'm going to perform hand hygiene and document my assessment.